Thanks for joining the Jobsite safety webinar during a pandemic, co-hosted by ACEC California chapter and SEAONC. My name is Daisy. I am a co-chair of the SEAONC's Business Forum Committee. Today's webinar will be an hour-long panel discussion followed by a 30 minutes Q&A. If you have any questions, please submit your questions via chat to Kevin Sand, who is the other co-host of the Business Forum Committee. This webinar will be recorded and posted later on ACEC website and SEAONC's website. Before we get started, I would like to advertise for a couple upcoming SEAONC events. There will be a SE3 panel discussion on lessons learned from the 2008 recession next Thursday, May 28th. And SEAONC June business meeting hosted online on June the 2nd. And continuing education webinar on the California existing building code. It will be a two-part webinar hosted on Wednesdays, June the 17th and the 24th. There will be emails from the SEAONC office regarding registration for each event. All right. Let me introduce the moderator of today's panel discussion, Brett Dede. Brett Dede is the Executive Director of the ACEC California chapter. All right, now I will turn the microphone to Brett.
Hello, thank you, Daisy. Welcome, everybody. Thank you for participating today with us for this very important discussion under these very challenging times that we're all experiencing right now. As I'm sure you're all probably aware and doing similar, you may be working from home, you may be working from another location. You never know what's going to come up in the background with sounds and noises and people walking into your office or setting where you're at. So bear with us. We'll make this thing work as best as we can. Before we get started, I'm gonna just ask that each of our panelists give a self-introduction, and I'll call your name out, and I'm just gonna walk down the list that we used to market this webinar. So I'll start with Greg. If you can just give us, Greg, your name, your company name, and that would be appreciated, and your title.
Yeah, my name is Greg Chohan with WebCore Builders, and I kind of manage the field operations and safety for WebCore. That's me.
Thanks, Greg. I'll go through with the other panelists now as well. So John, can you give us your self-intro?
Sure. John Galvin, President and CEO of KPFF.
Awesome. Thank you, John. Ken, can you give us your intro?
So good afternoon, Ken Odell. I'm a principal at MHP Structural Engineers, Long Beach, and a small office in San Diego.
Very good. Thank you. Twee, how about you?
Hi, everyone. Twee Fontalera. Company is Element Structural Engineers, and I am the principal founder.
Very good. And Jonathan, how about you?
Sure. My name's Jonathan Vick, and I'm a partner at the law firm of Atkinson, Anderson, Loya, Rood, and Romo. I'm down in Cerritos, but we have offices, 9 offices throughout the state.
Great. And one more. Tyler, how about you?
Yeah, Tyler Munzing, Government Affairs Director here at ACEC California. I'm a registered lobbyist, handle all the legislative stuff for ACC.
Very good. Thanks, Tyler. So with that in mind, you've seen who our panelists are now. I'm going to start walking down through a series of questions underneath these kinds of categories. We're going to start with a discussion, some questions about guidelines that are out there surrounding this pandemic and how it relates to worksite practice and on-site work. Then we're going to talk about preparation before job site visits. Then we're going to talk about on-site, what takes place there, and ask some questions. And then after that, we'll roll into some questions about what happens after a site visit and potential exposure. And then lastly, special requirements for critical facilities. That's kind of where we're at with this. And our panelists have expertise in various categories about our discussion today. I'm going to start at the top of the list with guidelines. And I'm going to pitch this question to Jonathan, and then Tyler can respond as well. But I'm curious, what are the current OSHA rules and statewide health mandates for construction-related activity? And then Jonathan, kind of piggyback into that, what are some proposed pieces of legislation that might relate to Cal OSHA rules or workers' compensation and something to that effect? So Jonathan, let you take this first.
Sure. Thanks so much. And thanks for everybody for joining us today. And just so you know, by way of background, I do a lot of OSHA. I actually started my career working for the U.S. Department of Labor, and federal OSHA was one of the agencies that we represented. So I cut my teeth on the enforcement side of OSHA and then went into private practice. So I always kind of bring the perspective I bring a lot of times maybe a little different from others, because I kind of have a better understanding, I think, about how OSHA looks at things and how their kind of enforcement perspective. What we'll be talking about today really is Cal OSHA, because we're in California, and that's the predominant OSHA regulations that we have to be concerned with. And if you have not downloaded it or gone to the Cal OSHA website, they have a guidance document that they issued on May 13th, 2020, called Safety and Health Guidance, COVID-19 Infection Prevention in Construction. If you have not looked at that, you should download it. So just from an overall OSHA perspective, and I've seen several complaint letters that have been issued by employees or passerbys to OSHA complaining about construction sites. And OSHA is relying on Title 8 Safety Order Section 3203, which is the Injury and Illness Prevention Plan. If you don't have one of those, you should. And if you do have one, you know what I'm talking about. But that's your really primary governing document for guidance, at least for Cal OSHA. And so the guidance they issued says it is not imposing any new liabilities or obligations. It's simply a restatement of what the current law is with regard to the IIPP. So what are we looking at? And so the first thing that you need to be prepared for if you're going to have employees out at the work site is you've got to make sure that you're training the employees on COVID-19. You need to train them in an understandable way, and that's the other key. For instance, if it's a Spanish speaker and you give them a document that's written in English, that's not effective communication. That's not an understandable form. So you're going to need to make sure that you communicate this and train your employees. And here we're talking about CDC guidelines. You've all heard about them, probably tired of hearing about them. Now it's kind of white noise and people are starting to ignore them, but they're really important. They talk about what are the symptoms of COVID-19? How are they spread? The CDC guidelines with regard to the social distancing, maintaining 6 feet, face cover, the cloth face coverings. The safety with regard to having hand sanitizers and washing stations, that you're going to have to make sure that you're training your employee in all of these safety protocols that are related to COVID-19. OSHA is looking to make sure that you're providing increased cleaning and disinfection on the work sites. So you should have you should have a written protocol for when you're cleaning and disinfecting. Right? Have a schedule, write it down. So if OSHA ever comes out and says, how do we know you're doing your cleaning and disinfecting? You can hand them a schedule. They'll explain what you did and when you did it. Written documentation is key if OSHA is going to get involved. You'll need to make sure that on the job site, you are addressing the physical distancing, and you'll need to identify choke points where they have to stand before they enter a work site. How many can be in an elevator or be in a hoist? How are you going to create that space? If you can't create that space, you need to think about coming up with some type of controls or barriers to separate employees. Spread them out. Stagger shifts. if you can. But you need to evaluate the hazards, because Cal OSHA, if they come out and do an inspection, they're going to know that you went out and evaluated the hazards and you tried to address them. If you're dealing with the unions and you're getting employees out of the hiring hall, you need to make sure you're training them. You can't simply rely upon training they may or may not have had, because if it does an interview, they're going to ask about the training you as the employer provided. You'll need to make sure that you are, posting signs about where the hand washing stations are, and you'll also need to. I recommend they're wearing these cloth face coverings. It's not going to protect someone from transmission or exposure, but what it does is it does, reduce the transmission or the exposure. And I think on some level, it makes employees feel safer. Some employees are anxious about working now, and so I've had a number of conversations with OSHA inspectors that have said, employees call them and say they're concerned because the employer is not making everyone wear these cloth face masks. And so while there's some people that disagree about the effectiveness or whether you need them, I'll just say from a standpoint of employee morale, the employees are calling about that and they're concerned. And so OSHA is looking into that.
Hey, Jonathan, let me pause just for a second.
Sure.
I want to make sure that we're able to get that Cal OSHA link that you talked about as well. Maybe you could kick that out to us, and Daisy, maybe you can then send it out to all the participants that were on board, or we can post it to our respective websites too. And there's a lot of what you're talking about right now, David, just again, in the interest, not David, Jonathan, in the interest of time, is this all listed in that line item by line item like that, like you're talking about?
Most of it is, yes. There's some things like, conversations I've had with Cal OSHA and things they're looking for is not, but most of it is listed in there. And you take a look at it and you comply with this, you're going to be in good stead in the event that Cal OSHA does an inspection. But you also need to be mindful of the whatever local, like LA City has their own protocol for LA City, and they're in the Bay Area counties have their own protocol. So you need to make sure that you're aware of what not only Cal OSHA, but whatever local city and county orders may be out there.
So Jonathan, this almost sounds like it could be an entire webinar in itself, looking just at all those Cal OSHA guidelines and how to implement, and there's probably could be a lot of questions just revolving around that. That's something maybe SEAONC and ACEC should think about even as a follow-up webinar just around that concept. Is there anything else in particular in Cal OSHA rules that we should be aware of? Again, I'm just trying to push us along because we've got a lot to cover. Or should we jump over to work comp?
I think that if you look at this publication from Cal OSHA in the construction industry, that's going to provide you most of the guidance that you need. You also may need to be aware of like respiratory protection. If you have a respiratory protection program, if you're required because of exposure, not a COVID-19 exposure, but just another exposure in the workplace, to be mindful of the respiratory protection program. That's the other one that's most important.
Okay, well, let's transition now to this legislation that's come about regarding, I think it's workers' compensation, right?
Correct.
Give a little update about that, and then Tyler, if you want to piggyback on that, then we'll move on.
So you may have heard that Governor Newsom signed an executive order that created a rebuttable presumption for workers' compensation cases for employees that are exposed to COVID-19. And to qualify, you have to have the place of employment was not the employee's home, so they actually have to be out at the workplace. It has to be a diagnosis by a licensed physician in California. It has to be made, the diagnosis must be made within 14 days of the last day the employee worked. And this had to occur after March 19th. The idea behind this rebuttable presumption was a lot of employees had to go to work as for critical infrastructure and essential employees. And so the governor initially proposed a conclusive presumption, but after a lot of input from various organizations, he changed it to a rebuttable presumption. And so you want to basically, this will allow a presumption that if a person has a positive COVID-19 test that is work-related, the employer then can rebut that. But you have to provide evidence, do an investigation, and provide evidence. It gets more complicated than that, but that's the overall idea of this presumption.
Tyler, what about the politics behind that and what's going on at the Capitol on the subject matter.
Yeah. So there's a couple bills that are going through at the same time. The governor's executive order has that rebuttable presumption. I would probably just read that as it's going to be a high hurdle. Unless you're doing extensive contact tracing, you're able to, keep tabs on what your employees are doing, when they are on the job as well as when they're not, because the burden of proof now is on the firms to provide evidence to the contrary that they did not contract COVID-19 on the job site or when they're out of their homes working. And so it's going to be pretty difficult unless you have, photos of them at Newport Beach, with 5 other people, and, those people were in the right place at the right time, had COVID as well. And without extensive contact tracing, I think that's going to be pretty difficult to rebut. But nevertheless, there is an opportunity to rebut, which is positive. The other piece of it too is, so the Workers' Comp Insurance Rating Bureau came out and said that this is not going to impact an employer's experience modification rating. They can also, still apportion liability for any other permanent disability requirements. So those are positive. And again, this is limited to COVID-19 for a specified period of time. So it is possible that we'll see something extending this if the COVID crisis proceeds further. But, as we're seeing now 53 out of 58 counties being authorized to move into phase 2 and potentially beyond, unless there's another, outbreak or another peak, then it seems like probably unlikely that we'll see an extension. Those bills that I talked about going to the legislature, one of them is AB 196. It's a Lorena Gonzalez bill. That one would have a conclusive presumption, so non-rebuttable for all essential workers. That one's moving its way through the legislature. The other 2 apply less to our industry. One is, it's a AB 664, which is specific to public safety and hospital personnel. And so not really us in any way, shape, or form. It's like firefighters, nurses, doctors, that sort of thing. And the last one is similar-ish. It's SB 1150. And this one has a new definition of a critical worker. So forget about essential workers. Critical workers is anybody who is directly involved in combating the spread of COVID-19. And this one is also a rebuttable presumption. So really the only way that this would impact any of us is if for whatever reason somebody from your firm was on company time and on behalf of the company was like volunteering at a hospital. Again, they're being paid to do this. I cannot see that happening necessarily. So
Okay.
yeah, those are the bills.
All right, let's keep it moving along then.
Hey, Brad, can I interrupt you?
Please.
Jonathan, I have a question. As a firm leader, we're wondering about whether this whole thing about workman's comp claims exposes us to potential liabilities beyond just workers' comp claims as firms. So if we open up our offices and a bunch of people get sick, I understand the workman's comp claim, but is there liability from your perspective that's beyond that for employers that for some reason their employees get sick?
Well, there's the potential, yes. Now, the presumption only applies in the workers' compensation system. I actually had a conversation with someone who said, well, if an employee gets sick at work, they go home and then their family gets sick. They get it from them. Does the family then have a right, a cause of action against the employer for sending home a sick family member? And the answer is potentially yes. I don't think that the presumption would apply, but if you're a premises, if you own property and you premises liability and it's an unsafe condition, it's not known by by whoever is invited on, then there is that potential exposure. I will say, while it's possible, if you're taking precautions in this day and age, I think the likelihood of that, unless there's really good evidence that you knew that there was a source of COVID-19 and you invited people into your business and you didn't tell them about it, I think it'd take that type of facts, because otherwise it's going to be difficult to prove the exposure occurred at your business.
Okay, let's keep, good. Thank you, Jonathan, and thank you for the question. I think it was John who asked the question. I'm going to keep moving now through. We've got a number of other items we want to get through and engage the other panelists in discussion as well. I'm going to pitch this question over to Greg about Greg, how does your firm track changes and comply with constantly changing legal restrictions and guidelines? What do you have to say about that, Greg?
Yeah, thanks, Brad. Yeah, that's a tough one. There's a lot of things out there, and there's a bunch of things that are constantly sent out. So, what we kind of did at first was we set up almost twice a day meetings. We kind of end up taking the field leaders and we took our safety leaders, and twice a day we had a quick huddle. We had a quick conference call, about 15 to 20 minutes, just to start aligning efforts and aligning sources of truth. And we kind of stayed on top of that. So we kind of have routine meetings, and we kind of have this little bit of a mini task force that we have, and each of them has some responsibilities on following up with some documents constantly. We also have kind of connected with a few organizations that kind of help us. So we have actually a lobbyist that kind of gives us information every day on the Newsom updates or any other updates that are out there. But it's kind of like creating a task force that is going to stay on top of it. But it's also kind of recognizing where the source of truth needs to come from. So it's kind of sticking to the health orders. It's sticking to Cal OSHA. It's sticking to the CDC guidelines, and also going to the California State Health Department and using those informations and trying to stay away from the things that are in the media, because you can go down rabbit holes really, really fast. And then making sure people are assigned to be the champions of various county health orders. We have somebody that stays on top of the LA documents. We have someone that stays on top of Alameda, someone that stays on top of San Francisco. So it's creating a task force and making sure that they're all staying on top of what they are responsible for, and then coming together weekly or more than once a week to kind of share that information. And then what we have is we have an internal web page that we have that we constantly keep updated with all our documentation and all our information, so that it's accessible to all our employees. And we also have it for kind of our for our owners, so that they can see what we have going on. So I hope that kind of answers the question, Brad.
Yeah, good. I wonder, Ken, did you have anything you wanted to add on how your company handles this kind of stuff?
Well, I had a sense that we were going to get kind of the big answer from the contracting side that has some resources and so forth. So kind of speaking for the smaller firm component, Greg, you got a great task force for a smaller firm. I am that task force. So it's really kind of taking the time, getting into it. And a great point from Greg is I'm really trying to make sure that I find those right benchmarks. CDC, Cal OSHA, the specific orders of the counties that we're practicing in or that we have job sites in, and really trying to narrow it down and not allow us to go, if you will, above and beyond. It's a little bit of trepidation, which is why I really appreciated the opportunity to participate in this conversation. Almost more, I'm probably taking more notes than most people today, just because this is going to be a great resource for a firm my size.
Okay, very good. And speaking of resources, I know that Jonathan gave us a website for Cal OSHA. Greg, I think you might have an idea where there are some other resources on how to address issues like this on the job site.
Yeah, I mean, it's kind of like every county has their own sort of health order, and you can, I mean, one of the key things are signing up for the alerts. So there's I think, I'm not sure what it is, but there's a Everbridge. It's a texting thing. Every county has it. So sign up and you will get the automatic alerts that way. And then sign up for the emails. The emails and the texts are by far the best way of staying on top of every county health update that is sent out.
Very good. Does any of the other panelists have anything they want to say about where to find resources?
Brad, this is Twee. I hear Ken's sentiment, and I'm pretty much in the same boat. He is taking notes and whatnot. But one thing that I have been doing besides, looking at all the standard CDC website and whatnot, is really reaching out to our insurance broker. And she's been really great in terms of providing resources in terms of, okay, site visit, what protocol should we follow? Video conferencing, we all know photos can, it's 1,000 words, and in a way, it gets us in trouble too. So now that we're doing more video site visit, how is the recording? If we do recording, how does that impact us? And so I've been leveraging our insurance broker as a resource to try to understand, I guess, more of the liability end. And then as well for us, we can't keep up with every county and city because, like Ken, I am it. So what we do as our team is, the minute we get a request for site visit or anything like that, and we deal a lot with homeowners and smaller projects like remodels and whatnot too. So some of the Cal OSHA regulation, even though they should follow it, I can't say that it's being followed completely. So what we do is we always lean on the contractor to make sure that they understand some of the protocols and the essential business, whether we are permitted to operate in that capacity. Especially, we got a couple of projects that are just residential remodel, but it needs to be essential because the homeowner is living in it. So those are the kind of scale that we sometimes have to deal with homeowners and that. So we lean on the contractor and our insurance broker to help us out.
Okay, that's good to know. I guess I'll also put a pitch in here too. If you'll go to the ACEC California website, we've got updates that we're putting out regularly as well, and on our updates page about this stuff. And I'm sure some other SEAONC might do that as well, and there are probably some other professional associations that are doing the same. I'm going to move on here in the essence of time and keep clicking through these. We wanted to talk a little bit about preparation before site visits and ask a few questions. And I'm going to start with John over at KPFF, and maybe there are some things that smaller firms can learn from larger firms in this vein as well. So John, I'm going to start with this question: Are virtual site visits possible and reasonable? And then we can go into some components of that. Does that work?
Sure, that's fine. I think we've actually been doing virtual site visits for more than a year, probably a couple of years, that we've been kind of adapting the solution to meet the problem. So there are times when looking at a set of photos or having somebody connect via FaceTime, walk around a job site, show you what you want to see, makes a lot of sense. And so that's not new for this pandemic for us. It's something that we do when we need to do it. Right now, what we're asking is to lean towards that, right? We're asking our clients if that's acceptable to them. We'd like to minimize the exposure that our employees have to those kinds of risks. And so if there's a reasonable, logical way to do it virtually, that's where we're leaning, and we're trying to go that way. And then if they don't believe there's a reasonable, logical way to do it, the other thing that we're doing is we're asking our employees if they're comfortable with doing this, and if they're not comfortable, there's no problem with them not doing it. And so our principals will kind of step up and take care of the site visits if the people who are working on the job are less comfortable.
Mm-hmm. I'm just gonna keep walking through. I see a question that came through that's kind of interesting and it relates to this also. So when you're on a job site, is it possible to maintain 6-foot distancing requirements? And can maybe some of you talk a little bit about the realities of how to do that on a job site and keep physical distancing? Anybody want to jump in with that one? You want to start with you? Just stick with you, John.
Sure. You can certainly request to perform your site visit when the construction is complete for the day, which takes all of the workers out of the equation. That's a really simple thing to do. You can request to walk alone, or walk with somebody that is socially distanced from you. So I do think it's possible. You didn't ask this question, but one of the things about preparation for any of this is really the interaction with the contractor. As soon as we get a request, we say, how's your job site set up? What's your protocol? What are the rules of engagement there? We want to make sure that they have it figured out and that we're comfortable that they have it figured out and that whoever's going knows what the protocol is for that job site and is ready to follow.
And so to piggyback on that then, John, also tools that an engineer could use to help the contractor build the project in a safe manner. What are some tools that an engineer can use to help in that vein?
Well, I already mentioned just photos, FaceTime, those kinds of things are really simple ways, and you can kind of work your way through whether you get enough from asking for a set of photos of the conditions you want to look at. If you feel like you haven't seen what you need to see, ask somebody to walk around with a camera and show you what you need to see. And then if for some reason you're still uncomfortable, then look at the actual job site visit. So we kind of walk our way into it.
Got it. Okay. I'm going to keep running through some questions here then. I'm going to pitch this one to Twee. Twee, how does your firm handle a request for a site visit if a local or statewide health ordinance prohibits travel or the visit itself?
Yeah, so I would say that at the beginning of our shelter in place, we definitely put in a protocol where we are not performing site visit. So that did create some, obviously, some challenges there. So prior to this COVID, we haven't done a lot of virtual site visit. So most of our site visit has been in person and then through photos. In our situation, I would say that sometimes I would say the workmanship or the quality of construction could hinder us from being able to do virtual site visits, only because the smaller contractors don't have that capability. And so it makes it harder to do that. But what we have done is obviously adapt. So we talk to them, say, okay, how critical is this project task that they need to do? Can they wait for the 2 weeks to be lifted? Or if they can't, then we ask them to do the FaceTime. And one important thing that we've learned from doing the virtual site visit is really coordinating with the contractor on where they're going to start the FaceTime, where they're going to start the site visit as far as the virtual site visit, right? Or else you're going to spend the first 5 to 10 minutes trying to figure out what direction they're going and whatnot. So we try to save time by sending them more of like a diagram of like, okay, this is where we need you to start, and you're gonna walk either counterclockwise or clockwise. And so that's been working good with the FaceTime because most people have a smartphone now. So that's how we have been adjusting. One question that had been asked by our staff is, well, do we ask for recording? And we haven't requested that, and from our understanding, it's not always needed. So right now we're kind of staying away from recording any of the virtual site visit that's happening.
Okay, very good. Anybody have anything to add to that concept before we move on? All right.
Well, I was going to kind of, if I can, I was going to perhaps add the point counterpoint. We're struggling with the virtual site visits, and this being said by a guy who did a virtual coordination of a site in Kabul, Afghanistan. So I know it's possible, but also kind of working through some of the issues. Kind of benchmarking, we've been trying to benchmark with the contractors, where if we can get out for the first site visit, kind of set the stage, and then use the virtual site visits for subsequent ones, recognizing that subsequent site visits often have different trades involved. So does the benchmark really work? I love Twee's idea of kind of setting that pre-stage and mapping out the process. We've been developing kind of a guideline document for our firm and our employees, which really, again, kind of goes back to sets the stage. Let's do everything we can to understand what we need to look at when we're there on site. We want to set the expectation that that is our purpose on site. So we really want to focus on the fact that we're there for this review. We're going to get in, we're going to get it done, and then we're going to get off, and we're going to avoid going with off-agenda conversations. It allows us to kind of set the expectation that, you know, let's team up with the person who is the decision maker on site. So let's not have the collection of sub-consultants that previous to this you may experience on a site visit with, you know, that list of questions that, hey, the engineer's on site, let's get all of our questions answered. It helps us reframe that back to, this is for this purpose, we're going to tackle it, and we're going to get back off.
Very good.
Just quickly, I do want to follow up. Can we that's what we find to be most helpful, because with the smaller projects, like I said, it comes down to sometimes just understanding our drawings. So we do a benchmark. We prefer to do a benchmark site visit. We provide a site visit report that have basically a key plan of all of our comments. So the contractors can see exactly what location these issues that we're having or hold down that are missing are required. So from that benchmark site visit, it definitely make the follow-up virtual site visit and photo a lot easier. And we do have a list, and I'm pretty sure most of us do, and that is a list of things that we want to look at when we go out to the site visit, or a foundation observation, or a framing observation. So our staff have to review that and coordinate with the contractor to make sure that, okay, like Ken said, be very specific, you know, and what is the purpose of the site visit? If it's just for lateral, that is all we're going to focus on. Make sure that there's no other trade on site if they can help it. And usually, so far for us, it has been working well, where with the smaller contractor, it's just the owner or that one person. And then coordinating with the homeowner in our case to make sure that they are comfortable with us going on site, and that they are protected in terms of, is there, you know, if we're doing an interior remodel, is there a path that we can take to lessen the exposure that we have to deal with for homeowners. So virtual site visits are great, but it's not something that we as a firm is used to, and our contractors. So the benchmarking is how we like to proceed with things right now. And we got a couple of projects where that's how we're handling it. And it's been pretty successful so far.
Okay. I'm going to keep moving along here. And I know we've got a number of questions we still want to try and get through. Is there anything regarding, and I'm going to ask this of all the panelists, regarding just the concept of preparation before a site visit? Is there anything else in particular that any of the panelists want to bring up on that concept that we haven't mentioned yet? I'm just going to throw it out to the panelists. In preparing for a site.
Well, yeah. Again, what we've been working through, and largely this is, as John said, kind of relying on some of our principals. We have a couple of key individuals who are our construction coordinators. And in preparation for getting them prepared and so forth is really to help set that conversation and expectation. You know, of course, we're responsible, or we have taken on the role to make sure that we talk about having the right equipment, having your masks, having your hand sanitizers if that's appropriate, having the ability to self-contain your sketches, your notes, you know, not leaving things behind and not collecting things from the job site. So it's the preparation is really that conversation, and it's really that setting of expectations for us.
Okay, very good. I'm going to throw it up, please.
Yeah, Brad, I'll just say, like, you know, most of our job sites are all set up that, you know, there's a control to get onto the job site, and there's this symptom checking process. And so you have to kind of get comfortable with that. You got to kind of understand that you will have to do a questionnaire. You'll have to have a queue, potentially know where you're standing. You might have a quick safety orientation. We kind of do that on all jobs every single day with the same content, just to refresh people. And it's a lot, like Kenneth says, a lot of mindset. It's like, but I can't stress, get comfortable with your PPE. If this is the first time you ever been to a job site wearing a mask and safety glasses, your glasses will fog up, and you really got to start getting comfortable with that. Like, that's probably the biggest prep that you can do, is getting comfortable with your PPE and knowing how you can maneuver with it and do what you need to do so that the visit is effective. That is one of the things that we have struggled in the construction to instruct our workers, how they can get comfortable wearing masks every day and trying to get the same volume or productive work done. So that's probably the biggest thing that people ask me is, do I really need to keep my mask on? And where I was like, yes, you do. Just wanted to share that.
Brad,
Please.
that raises a question that I'd love to toss to Jonathan. Is for many of us on this call, we're the engineer or we're the consultant showing up to a site that we don't control. So our prep is to prepare our staff to follow the guidelines of the contractor or the site owner that may set up the control. Where does our role to prepare our employee for that site visit come against or work with, I guess is a better way to phrase it, work with the fact that we have to eventually, as soon as we show up on site, adopt somebody else's program that we may not be as familiar with?
Yeah, so every employer in the state of California has an obligation to train their employees. And so when you're sending your employees out to another work site, you might have to comply with those requirements, but you've got to make sure that your employees are trained. There's a concept in OSHA called multi-site employer or multi-employer site. And so if there's a violation on a work site, Cal OSHA can issue citations to whoever created the hazard, whose employees were exposed to it, who controls the site. So from an OSHA standpoint, OSHA can cite multiple entities for violating their own IIPP. So while you might have to comply as a subcontractor or an engineer going out to a construction site, you might have to comply with whatever requirements are there. You still have an independent obligation to train your employees and to make sure that they understand what the hazards are and that they're prepared in advance.
Good comment. Good response. Thank you, Jonathan. Before I move on to a little bit more discussion about what takes place while on site, and I know we've done a little bit of that already, are there any other comments from any of the panelists about work to be done in preparation for coming out to a site? Anything that we've missed? And I might also pitch that to our folks from behind the scenes here. Pull up a question for me if I've missed anything.
Part of it, one comment, Brad, is, and like Jonathan made a point, like you can, if you know you're going to a job site, ask for their protocols ahead of time so that you can kind of review it. it is really important that when you do that, you're going to share information, your name, your address, your email, your phone number. That contact tracing is really important. So if you're getting there and they're asking for you for all this information and you don't give it, don't be surprised if they don't let you on site. So ask for the protocols ahead of time would be my recommendation.
Okay.
Great point.
Right. I saw a question pop up here that I may as well just pitch out right now to the audience, asking what are state regulations and guidelines on providing COVID-19 PPE, face masks, hard hat, face shields, or employees or employers responsible for providing the required PPE? I suppose that's Jonathan.
Yes, and employers they're required, if it's mandatory personal protective equipment, then the employer has to provide it to the employees.
Okay, all right, good enough. If there are no other comments about preparation before a site visit, I'm going to move on. And if I missed anything, Kevin, I know you're working in the background looking at questions. Maybe just pop one up on Google Docs and I'll read that out if I missed anything. But jumping on to what's taking place on site, and I think I already addressed this a little bit earlier about how to keep social distance while navigating a job site. This question is about especially for an architect or an engineer who's not familiar with a site that's changing every day. Does anybody have some comments about that? How to keep social distancing beyond what was said a little bit earlier? Any new comments?
The only thing I can think of is perhaps using some kind of like pointer there's going to be cases where you're going to have to look at something a little bit more up close, right? It could be a connection detail, whatnot. That's not what it's not per plan. And so besides huddling together like we usually do, maybe having some kind of pointer stick could be a way to keep the social distancing.
Mm-hmm. Mm-hmm. Good idea. Makes sense. How about, well, here's another question related to that. How should an engineer navigate confined spaces and collaborating with trade contractor on site to solve construction issues in confined spaces? You just said that, Twee. I think that was one good example of how to do that. Any other ideas from anybody?
Yeah, Brad, sometimes you can use if people are trying to, part of it is just to make a point is understand the difference between direct contact and casual contact. So people, one of the things that we've been trying to work through is hoists and elevators where workers go in and we've reduced capacity. So sometimes that is kind of one of those things that out there we've figured out there's a lot of good guidance with social distancing in an elevator. But you know, sometimes it's just like you can walk a space, and if you're going into an area that's like a room that's small and you're trying to check it, is like you kind of do that common sense one at a time type approach so that people get a viewpoint of it. The pointer is a great thing. There's also kind of utilizing a camera on a stick to an iPad and kind of sharing that sort of tool. So if you're doing some sort of inspections and stuff like that, there's little things like that, like camera on a stick on an iPad where people can review. But again, the most important thing for people is like all of a sudden be really, really aware of your hands, because if you're sharing a device like that, it's keeping your hands clean and not going back. So, but there's lots of little things like that that job sites are working on.
Mm-hmm. So I'm going to stick with you for a minute here, Greg, then, and let's delve just a little bit more into this. And maybe you might have said something about this earlier, but as a contractor, you know, what are some of the other detailed things that maybe contractors are doing on a job site to ensure safety of employees and consultants, like signs, posters, marks on the ground, just generally speaking, those kinds of concepts?
Yeah, I think in general, you know, there's a lot of construction that can get done with the separation, but I think it was Kenneth or Jonathan mentioned a choke point. And so we try and control the choke points as best as possible with putting markings on the ground. Waiting for an elevator is a choke point. Sometimes the gate entrance is definitely a choke point. Bathrooms, eating areas, those all become choke points. You know, workers going in and out of a large room, that door could be a choke point. And so part of it is just the getting into the mindset that it's out there and you got to be aware of it and kind of know your surroundings. And it's really just kind of that cultural mindset of trying to know where you are at all times. That's probably the biggest kind of thing. I mean, definitely pay attention to the signs and kind of understand. Sometimes the one thing too for people to be aware is there's a lot of cleaning products out there. There's a lot of stuff like that that's there too. So, you might be touching a surface that just got wet with the cleaning product. So can't stress for people to wear gloves. It's just getting familiar that there could be things you might touch something that's wet and it happens to do something that they just cleaned. So it's just kind of being familiar with what's really happening on the job site in terms of, just your awareness, really. I'm not sure if that kind of answers it or if others have more questions related to that.
Yeah. Anybody have anything else they want to say about that before? After this, I want to move on to after a site visit and potential exposure. Any other comments on site?
Yeah, I mean, my comment is, at the end of the day, we're all affected by this. And there's going to be, some of us are going to be a little bit more, I guess, hesitant to ask people to step aside. I just want to remind everyone that we're in this together. Everybody understands the situation. So it's really important to exercise communication and be able to say, hey, look, we're on here on the job site, and communication is key, right? Checking in, knowing who you're supposed to contact, have their cell phone handy so that when you get there, you can call them. Usually we visit the trailer. Well, that may not be practical anymore. So have the cell phone of the person you're supposed to connect with. And if possible, when you walk it, make sure you communicate that, hey, I need to go into this unit. Can we make sure that people are clear? Because obviously things are going to happen differently where all the different trades are not going to be working over each other like they used to be. So it's really key that everybody feel comfortable with communicating and making sure that they're mindful not to touch things if possible, and perhaps maybe the job site providing an area that the engineer or visitors can, once they get out of that gate, be able to dispose their disposable protective gear before they get into the car. I mean, for us, one of the preparation is making sure that employees make sure they have their hand sanitizer, their glove, their hard hat, all the necessary PPE. But either make sure you have a disposable bag in your car now, or perhaps have a place at the entrance that they can dispose of those protective gear if, when needed. So communication to me is key here, and there should be no hesitating in communicating. It's really how you communicate that's gonna, lead to offending anybody. Because I've seen people there where they put themselves in jeopardy because they're too shy to say, excuse me, can you move over so I can get through, right? Mm-hmm. So that's kind of just a reminder for especially the younger staff where when they go out there that they can exercise their communication.
Yeah, okay, very good. We're approaching 12:55 now. We've got about 35 minutes left, and I want to get through a couple more questions and then ask and then allow to open it up for even more questions from the audience. But let's talk about after a site visit and potential exposure. After a site visit, and I think I'll start with, I think John may be on this one first, John Gavin with KPFF. After a site visit, what protocols are your firm employing to track potential exposure to COVID-19 if someone that worked on the project site has tested positive for COVID-19?
One thing I would say is this is yet another place that you kind of need to flip this around to the person whose job site it is. When you ask for what their protocol is, you need to understand that they are contact tracing and that they have a method so that they can let us know, because we're not going to know that someone on that job site was exposed unless we're confident that that builder or that person in control of that site has a process to notify us. Just a quick story. We had a couple of surveyors that were working in it was a critical facility because it's a meat processing facility up in the Pacific Northwest. And they were, they did their work and they needed to go into this facility to do their work, working with a contractor, but the owner also has all these, employees working there. 5 days later, they saw on the news that there was an outbreak of COVID at that facility, and no one had contacted us in any way, shape, or form. And so it's even more complicated in that if it is also a functional business, it's not just the contractor that you're there on the construction project, but it may also be to understand that there's protocols in place for the owner's operations, that if anyone within the owner's operations gets something that you're gonna somehow get notified. So I think for us, it's more about the communication with all the other parties. It's on us when we reopen our offices, right? To figure out who's there when, so that we can do contact tracing and be able to understand who may have been exposed to who. I think it's on the contractor who is controlling a job site to have something in place to let us know. And it's on us to make sure that they do.
Mm-hmm. Okay. Greg or Twee, I wonder if you had anything to add to that concept?
No, I think John hit it there with, just being able to have somebody contact you. I mean, in that situation, what do you do? Who do you contact then? If you heard it on the news, John, I mean, who do you contact? So is there, what kind of protocol does each company have? And I guess it's going to be up to us to know who the contact point is, so that when we hear things on the news, that we're going to be able to call and say, hey, should we do something about it? I mean, us right now, we don't have any protocol in place. We are leaning on the contractor to give us that information.
Mm-hmm. Okay.
Yeah, I mean, we had to be prepared to cascade that contract tracing between those people and whoever they were in contact with within our own organization, to see whether there's other people who should go get tested or self-isolate. So that part's on us. I think for us, that was a lesson learned about asking more thorough questions about what their process is, because we don't want our employees to find something out like that on the news. That's not a success story.
Let me tie into this question with another question, and a couple of questions here actually. And Jonathan, this might be for you, Jonathan Vick. Are there any regulations or guidelines in place to maintain a log of all visitors to construction sites to aid in contact tracing after a potential exposure? And then a follow-up to that, is relying on the contractor or owner sufficient for visitors for contact tracing?
There is a requirement under, like LA City has a requirement that you have to keep a log of all visitors to a job site. So you might have to look at individual county and city ordinances. I don't know that Cal OSHA requires that. I don't think that they do, but I think that that's a practice that the general contractors should implement in this environment, because that's the only way you can do contact tracing. They should keep some kind of record of vendors and suppliers and whoever the visitors are that are out there. With regard to, can you rely, if you're a subcontractor or you are a vendor or an engineer and you go to a job site, can you rely on the general contractor? That's really the only option you have. I mean, unless you're going to have someone out there all the time. And so, I would err on the side of asking the questions. It's, I think Tu said earlier, communication is important. There should be a free flow of communication between the general contractor and the engineers and subcontractors at the job site. And so I think that you should ask, has anyone tested positive?
Okay.
Yeah.
I'm going to lead up to a question here for Greg. Then, as we move on about this after a site visit and potential exposure, one kind of I don't know if this is an easy question, but it's kind of straightforward. And then I want to follow up on what happens if an employee calls in sick. But after a site visit, and I'll pitch this to you, Greg, first, and maybe somebody else knows, after the site visit, is it still required or recommended to change out of your clothes and wash them right away in a separate load before entering a home or the apartment? Do you know that, Greg, or does anybody else on the panel?
You know, it's a good question. I don't think I don't really know if I have a great answer for that. And I would say, like, you probably recommend to discussing with an industrial hygienist. I do know that for our elevator operator who is in a role where he is constantly interacting with, you know, hundreds of workers in a day on a large job site, we are putting on disposable Tyvek for him so that he can, you know, kind of take off those clothes before he leaves the job site. So he's in a little bit of a different circumstance because he's totally kind of exposed to lots of people. But if you go on a job site and you're doing your job site walk, you gotta have to kind of, like, this is a mental thing that we want people to understand. Like, our job sites should be safer than you feel in a supermarket. And so if you're gonna go to the supermarket and buy a bunch of produce and foods, do you kind of do the same thing before you go to the house? So that's kind of like a little bit of a health check mentally that you can do. Is like, did I feel safer than I did in the supermarket? So that's the best guidance I can give on that, Brad.
Fair enough. And now let's follow up with that, Greg, but with this question about what happens if an employee calls in sick after, you know, having maybe been on one of the sites, saying that they have flu-like symptoms, and how does that impact contact tracing?
Yep, it's a great question. So, and there's two parts to that. So we have about 25 job sites in the Bay Area, and we have, you know, like probably a dozen in LA, and we have had this circumstance come up on a job site where, you know, we have a worker that goes to work on a Monday or Tuesday, and then he calls his supervisor on a Wednesday, say, hey, I'm sick. And our supervisor says, stay at home, don't come and work. You're what we call is on, you know, precautionary quarantine until you figure out what figure out yourself. And, you know, he ends up going to go get tested, or he goes to his medical provider and kind of figures out. And let's say he does test positive, right? And he calls us back and says, hey, yes, I'm positive for COVID-19. Then what we're going to do is we're going to ask him, I'm like, hey, is it okay if we use your name and investigate people who you may have been with? And so we conduct an interview with the guy and say, you know, hey, John, who did you work with on Monday? Who did you work with on Tuesday? And for us, we go back 2 days because it's a little bit uncertain if it's 2 or 4 days. But right now we're kind of doing a 2-day rule. And so we'll talk to our guy and find out who he's been with in contact for a couple of days. Did he carpool with anybody? And then we take the next step and start interviewing those people to try and figure out, you know, who, I'm using John as an example, who John may have been with. And then we kind of go down that path, and all those people that have been in what we're going to call direct contact, meaning they really work close together, they were exchanging tools, sharing ladders, etc. We put all those people into a precautionary quarantine, and then, you know, they have to go to their medical care provider and get tested, etc. And so that's kind of the process that we have implemented on our projects. And, you know, we take it very slow, and we're very deliberate, and we're very intentional on an investigation to just making sure that we're communicating well. And, you know, every project has somebody that is going to lead that effort on that contact tracing. And so that's how we're organized. And it's like the case, like if it's hard with visitors too, like and so one of the things that's really important with visitors that come to a job site, like let's say one of you guys goes to a job site and a couple days later you feel sick, you know, there is this like obligation. You should call that person at the job site, say, hey, by the way, I'm feeling sick today. Just want to let you know that I'm sick. I'm not sure what I have, blah, blah, blah. At least the person has the heads up that you might have been, you know, you might have been the unknown carrier and you're not knowing it. So there's a lot of little things like that. And that's why it's really important about the log, your name, your phone number, your email, the point of contact, and getting that before you go into the site, and knowing that there's obligations on both sides. There's obligations on us as the controlling contractor to call you in case there's something, and there's an obligation by you guys also to call the contractor if you feel sick. So I think that hopefully that kind of explains it, Brad, as best as I can.
I know.
Brad, if I could, let me jump in on this because this is an important issue that, and I think we've had conflicting guidance from the CDC with how we handle. We know what we do if someone's tested positive, but then the next question is, well, let's see who worked in close proximity, because that's the way the CDC refers to it. Let's do an investigation who worked in close proximity. And the early guidance from CDC was that you would, if you worked in close proximity within 6 feet, then those workers would go into self-quarantine as Greg described. But the CDC came out with some updated guidance about 3 weeks ago with regard to critical infrastructure workers, where it kind of changed course, and it does not require, the employer still has to do the investigation, but it does not require self-quarantine for the employees that worked in close proximity. It requires those employees, you do symptom checking, but it requires those employees to do their own self-monitoring. And I'll tell you that at a project with a client, it was a subcontractor, and there was one of their workers tested positive. The other workers wanted to self-quarantine them, and they were in about, I don't know, 6 or 7 days into the 14-day self-quarantine, and these new CDC guidelines came out, and the general contractor sent them a 48-hour notice with a copy of the new CDC guidelines saying you need to show up to work or else we're going to replace you. So you got to be careful. The guidelines, got to be careful with that. And like I said, I think we've got inconsistent guidance. Cal OSHA says you need to contact the local public health officials if you have someone who tests positive to determine what you do with the other workers. Okay,
very helpful. Looks like we're closing in on when we just need to open this up to questions for everybody here. I really have, I want to jump into special requirements for critical facilities and just ask this, and maybe it's Jonathan who can respond to this one also. Are there any enhanced protocols for tenant improvements in partially occupied healthcare and critical care facilities, including hospitals, senior living, and assisted living facilities?
Yeah, there are, and it's not an across the board thing. And I wish I could give you better guidance on that, but there is what we call the aerosol transmissible disease standard, the ATD standard, and that doesn't cover everybody. It generally doesn't cover contractors, but what it does cover is hospitals, skilled nursing facilities, clinical medical offices. So if you're in an area and you're working somewhere where they're treating patients and we know that they're going to be patients, then you may have to comply with the ATD standard, and that's 8 California Code of Regulations, Section 5199. It's got a whole host of requirements that you have to comply with. And so if you are working in a hospital or a critical care facility, nursing home, then what I recommend is that you check the ATD standard to see if you have to comply with it.
Okay. The ATD standard. Maybe we can get that standard also, Kevin and Daisy, and kick that out to everybody as well. If you have a link to that, Jonathan, you want to send our direction, that'd be helpful too.
Sending right now.
Very good. Thank you. With that said, I think we already talked about general legislation. I was wondering if there's any other general legislation in Sacramento that we should be aware of. I think Tyler already covered that and Jonathan covered that up front. We are at about 20 minutes left in the program now, and I think that I've exhausted the questions that I had in advance. I see one question coming up right now that I'll read out, and I would encourage everybody to submit questions in the chat as Daisy asked earlier, and then we'll get these questions out for you. Here's one that came through. How are firms securing PPE given that supplies are sold out and back ordered for the majority of vendors? I have something I can say about that, but I'll defer to the panelists first. Anybody?
I was gonna offer again from the small firm perspective. you know, we're not trying to supply the N95 masks. We're recognizing that those tend to be reserved for the frontline people. But we have been successful over the course of probably 4 or 5 weeks now of making small orders on Amazon through, you know, I'm sure we're paying a fair price, a fairly good price, I guess. None of that makes sense, but we're paying for them. But you know, we've taken it on ourselves to do it constantly and slowly, and we're building up, you know, the face masks, we're building up the hand sanitizer, we're building up the gloves. Everything I read, and I don't want to in any way suggest that I am the health advisor that knows it, but most of what I'm reading is good soap and hand washing is one of the best things we can prepare our teams to do. That's not necessarily in short supply, but the rest of the PPE that we understand we will need as professionals has been available to us as long as we're not trying to do mass orders. You know, small orders seem to be successful for us.
Mm-hmm.
Yeah, Brad, I'll jump into, you know, we agree with Kenneth. I mean, we are focusing on the N95s for if we really need it, like for silica sort of construction, and we got that sort of work. But we want the healthcare providers to take care of the N95s and the K95. So we have definitely promoted and have pushed ourselves to go down cotton cloth face masks, and there's a lot of opportunities and a lot of resources out there. I can't stress the importance of getting familiar with the mask that works best for you. I've tried a few, but believe it or not, like an old-fashioned bandana by far is probably one of the best masks that a lot of construction workers use, because cotton is much better with heat. And that's kind of a key thing is an N95 and a K95 reduces your airflow, and long-term is not the greatest thing when you're in construction and you're walking around, that you got to kind of use the 2 layers of cloth is really the best sort of mask that we're finding out with most of our workers. So just kind of, there's a lot of resources out there for the cloth masks.
Just one other thing to add. It's very clear that the regulations are that the employer is to provide the PPE. We're exploring, getting this reviewed, but exploring that if an employee wants to provide their own PPE, that they can, if it makes them feel safe and comfortable, as long as it is, you know, meets some minimum of what is required. They can supply their own. And as we know, I think pretty much everybody who has not returned to work yet has a mask of some sort that they're using to go to the grocery store. They're developing some level of comfort with something. We're hoping just to take advantage of the fact that people have something they're comfortable with, have them use it in the workplace. We'll provide it if they need us to provide it for them and they ask us to provide it for them. So we'll have that limits the supply of what we need to do, as long as people are, you know, kind of volunteering to use their own things. Do you have any comments on that, Jonathan?
Yeah, I do. Just to comment on the N95 respirators. So the N95 respirators, if that's mandatory, you may be triggering the mandatory, if you mandate the use of it, then you may be triggering the respiratory protection program and requirements. And that can be a fairly extensive safety order to comply with medical evaluations, fit testing, things of that nature. So if an employee wants to voluntarily use the respirators, they can. Employer, you know, because we're talking about the N95s, but if they do, the employer still has to provide them with Appendix D, which is part of the respiratory protection standard. So if the employee wants to voluntarily use, if they have their own N95 mask, they can. But the employer still needs to make sure that they have, that you provide that Appendix D. With regard to the cloth face coverings, yeah, whether the employer provides it or you reimburse the employee $10 so they make their own. One of the things I recommend is that you make sure that those cloth face coverings are being washed daily. in between shifts. So make sure that they are being washed and they're being cleaned. And I've actually heard one doctor say, you know, get them wet at the end of the day, wash them, put them in the microwave for 2 minutes. I'm not sure if that's great medical advice or not, but I've heard that. But at least if you wash it and dry it in a dryer, that seems to be acceptable.
Okay. Anybody else have a comment about this? I have something to add on it too. Okay. We were informed early on in this shelter-in-place situation a couple of months ago. We reached out, ACEC California reached out to the governor's office and Cal OES Emergency Services and told them that we're willing to help any way that we can as an organization. And they took us up on that offer just a couple of days ago. They have a lot of masks, a lot of surgical masks and hand sanitizer warehoused at the state of California right now. And the state of California is reaching out to some associations to help disseminate that those materials. We sent a message out to our membership at ACEC California yesterday about that, and we are taking orders. It's free. We might have to put on, if we have to end up having to bring it to our office and then reship it, we might have to put on a shipping charge. And we're making it available to the A&E industry, even if you're not a member of ACEC California. So I think, Tyler, you have a link to our free PPE email blast. If you want to put that up in the chat.
Right now.
Yeah, go ahead, Tyler. Did you do that? Yeah, kick that out, Tyler, for anybody that's in here. And if you want to make that order, read that material, and we'll do the best we can. We don't know how much is going to be available, how much we're going to be able to get out. It's probably just a limited 2-week time frame. And we got crunched with a lot of requests in under 12 hours. So we'll do our best to try and help everybody get those. They're not the NV5 masks. They're non-surgical masks and hand sanitizer. And I think the minimum order for masks is like 2,000, and the minimum orders for hand sanitizer is, I can't remember how many gallons. 1 gallon? Okay.
Yeah. So we're gonna be working with smaller firms as well. So if you have an order that's sub 2,000, let us know. We can try and combine those and make sure that you're still able to get masks. But yeah, minimum order for masks is 2,000 and 1 gallon of hand sanitizer.
It's a fairly detailed form that you have to fill out for OES that we've included in there. So if you do that, give it a shot and we'll do the best we can to help you out. A couple other questions I see that are popping up here on the screen. And I think Jonathan may have already answered this. Let's see, is there a distinction between the industrial and medical grade NV5 masks regarding regulations? Also, what is the Appendix D that Jonathan mentioned? Did we cover that already? Jonathan, are you there?
So we did cover, I mean, getting into a discussion about the respirators is kind of complicated because there's different respirators, they have different ratings for different exposures. And so that's deeper in the weeds than we're going to get into today. And you really need to, look at that and talk to someone that's familiar with the respirators. I just say be careful with that because you may trigger the respiratory protection requirement, a protocol. And so it's not just a matter of buying it and start wearing it. As Greg mentioned, those respirators will affect your breathing. And so there's pulmonary function tests that you need to make sure you're medically fit before you can wear a respirator. And then you have to make sure there's fit testing. The Appendix D is a part of the respiratory protection, the safety order. I'm not exactly sure. I think it's 5144, but I'm not exactly sure.
Yep.
Is that right, Greg?
Yeah, 5144. It's Cal OSHA. So
right.
I sent the link out to everybody that it's a publication that's put out on it. So if you click on the link, it kind of takes you to a publication that Cal OSHA puts out. It goes in the weeds, but it's a good guide to kind of read and understand about the N95s. But Jonathan, just want people to understand the N95s. There's some N95s that you should not use because there's a one-way valve on it. And so it is not going to prevent your droplets from getting airborne. And so you got to be really careful and really understand the N95s that you use and a 3M versus a Moldex and which is the right one. So, you know, take the time to do the homework before you just pull the trigger and put on an N95.
I agree. And that's why I try to tell people you need to look into this, because there are different respirators for N95s. They're N95s, but they're different types. So you need to make sure you understand them before you start using them.
Very good. We're still, I think we've run through all of the questions we wanted to ask specifically. So now we're just waiting for questions to come through the chat. We've still got about 10 minutes left here. While we're waiting for questions, I could throw out this one question that's not necessarily relevant to job site safety, but nonetheless, there are some of you on the phone that are on the call, on the panel that might be able to respond to this. It's from a student who's listening and right now, and they're wondering, they'd like to know how the market is doing and any advice how to use the free time to prepare for the near future.
I would, I don't know how, it's hard to kind of say how the market's doing, but I would say that, you know, since this is, you know, I would think about like manufacturing as much as possible and how that the controlled environment is the way to go. I can't tell you how many more jobs that where pre-construction, I'm sorry, prefabrication and fabrication in a warehouse has become more of a topic because it's a much safer controlled environment where you can keep the distance. So that's where, I mean, all this brain power that you guys have should really think about how do we really start getting construction really dialed into prefabrication and manufacturing in a safer environment so that assembly requires less people on a job site.
Fair enough. Fair enough. Any other questions from the audience? We're while we're waiting to see if there are any other questions for the next 7 or 8 minutes here. Is there a topic?
Brad, if I can
please
just add something, follow up. There's a discussion about symptom checking, and that's happening at a lot of job sites. And this just is a comment. It may not apply so much. It may apply more to contractors than to the architects and engineers that are out there. But if you're recording the symptom, if you're asking questions and you're recording or writing down medical information, that is, we believe that's covered by the California Consumer Protection Act. The CCPA was passed, I would say, primarily because companies were gathering data about individuals, and then they're selling it, you know, on the internet sites, and they're gathering personal data and selling it. And the CCPA was passed last year to kind of prevent that. But it's a really broad act, and it requires a pre-collection notification. And so health information is one of the categories that it covers. So I would say if you are collecting that data and recording it and writing it down, that include temperatures. If you're keeping records of that, that should be maintained in a private personnel file for the employees. It should be marked confidential, and you also should be complying with the CCPA.
Very good. I see one question. Oh, go ahead.
Yeah, Brad, let me just, just so I can get a clarification on Jonathan's point, which is really good. What WebCore has done in order to make sure that we're staying compliant is our questions that we ask are yes, no. So we're not actually recording any information. And we are using basically a pass-fail on the temperature. So it's 104, pass-fail, no questions, nothing further, so that we are not recording anything that gets classified as into that HIPAA category. So if you are going to open up your offices and do symptom checkings, there's a lot of good questionnaires that are all yes, no questions, so that it's a little bit easier to navigate through some of those laws.
Yeah, just I'm sure a lot of people are also kind of pivoting towards that to return to the office piece. We're working hard on that right now too. We're looking at having people do that questionnaire as a self-assessment at home before they leave for the office. So get on a form that gets to a smart sheet or something, and answer a set of yes or no questions. One of, have you taken your temperature and is it below? 100.4, and then you've kind of validated that they've done the self-check every day, but you're not necessarily having somebody be the temperature taker at your front door. So we're kind of leaning towards that solution. And if somebody doesn't have a thermometer, then we can figure out another way or get them one. Or so just an idea that I thought I'd share.
Yeah, no.
Those are both good suggestions to avoid that record keeping requirement and the CCPA and all those obligations that come along with that.
Oh, very good. That was
Greg and John, do you know of any resources that have those sample questions that we can refer to?
Yeah, I can send you what we've been using, and like John mentioned, a QR, a smart sheet, but we basically have a QR code that's at the door, and you use your phone. It takes you to questionnaires and go through the questions, but they're the questions that we grab from the CDC website. We just put it into a yes/no format. There's 6 or 7 questions, and it gets logged into the smart sheet, and very few people have access to the smart sheet.
Yeah, the CDC's website is probably the best source for that. One thing I know a lot of people are said, we're small and where's a resource? There's that are providing a lot of good free information and sets of updates to people. I think, in hopes of some future business, I'm sure. But one in particular that looks like they're giving really, really good advice on an ongoing basis is a firm out of San Diego called Dunn DeSantis. So if you want to just Google DUNN DeSantis, you'll find them. And I'm just looking at an email from them. It's their update number 18 on COVID, and it's related to this topic on this day. What about temperature checks? What about these questions? So they're doing a good job of seeing what's new for kind of small business employers in the AEC space and what you might need to know. And it's a nice resource that they're putting together.
very
I
good.
mean, one thing that I'm thinking of is, so, we're in an office building. I'm pretty sure most people are. So even though we can do let's say our due diligence of checking our staff, the landlord now plays a role. I mean, how does the landlord plays a role in this, right? Because you're in a shared building with other people. So I'm just kind of thinking out loud, like how that would be practical to ask landlord to do their part in keeping their tenant safe, or is that just out of the question?
Well, the landlord's going to have it's interesting because I noticed this morning that there was a lawsuit filed by a rather large shoe manufacturing against the property owner for the building they lease space from for failing to comply with COVID-19 protections. And so this is something that we're starting to see. I would say, generally speaking, a landlord has an obligation to make the common areas safe. So I would expect that the landlord would at least be providing, cleaning and disinfecting and the social distancing, spacing, and addressing those issues. When it comes to like the tenants, they're not going to be able to. They're not going to necessarily perform, checks to get into the building. I don't think they necessarily have to. I mean, this is an area that is developing. So ask me in 2 weeks, and I might have a different opinion. But there is a requirement from the landlord, I think, at least to provide cleaning and disinfecting for the building in the common areas.
Okay, well, everybody, I think we've exhausted our time. We're right at 1:30 now. We've answered a lot of questions from folks. I do want to remind everybody that this webinar is going to be posted online for future reference. So watch for that. And I also want to add that the website links that were posted in the chat are going to be compiled and then also posted. And we'll have those on our ACEC California website, and then SEAONC will do it as well. With that, I don't want to go over our timeline, but is there any other pressing issue that we didn't mention that one of the panelists wants to mention before we hand it over back to Daisy for closing?
You know, I just make one comment. John talked about the firm in San Diego. You can go to our website at Atkinson, Anderson, Lawyer, Rude, and Romo. We've been providing updates, and it's not just on construction. We also do labor and employment. I'm not sure what the other firm does, but the updates that we've been providing will address construction as well as labor and employment issues and all of the small business loans, the PPP, all of those requirements for the stimulus package. We've got updates on all of that.
Very good. Thank you, Jonathan. Any other closing comment from any of the other panelists?
I just like to toss out that one of the reasons that this was an exciting conversation to participate in is because it's a conversation amongst peers and colleagues. It doesn't have to stop as soon as we hang up today. Let's make sure that we keep sharing ideas amongst ourselves and make sure that we keep moving the industry forward.
Excellent comment, Ken. Yes. Okay. Well, with that, Daisy, I'm going to say thank you to our panelists and thank you to everybody for participating, and I'll hand it back to you, Daisy.
Thanks, Brad. The only thing I want to add is thank you, Brad, for moderating this. This is a very good conversation. Thank you.
Pleasure.
All right, so this is it for today's webinar. Thank you everyone for joining. I'm going to end this meeting. Thank you.
Thanks for having us.
Thank you.
Take care.